This is Jerry Hesch from Hesch Institute in Aurora, Colorado, and I'm a physical therapist, and this is a presentation on what I call type 2 or osteopathic inflare outflare of the pelvis. And there's some debate as to whether or not this pattern has anything to do with the sacroiliac joint. And nobody knows, no one's done the research, and I like to be a little cautious in my interpretation. Osteopathic inflare is subtle because it involves more of a medial and lateral movement of the pelvis, and the way that I test for it is in sideline. And so in sideline I load the front of the pelvis, the front of the ilium, and I spring it medially, and then I spring the back of the ilium and I spring that medially, or being on the right side, I spring it to the left side. And then of course I would have the person flip over on the other side, and I would repeat that springing on both sides. And most of us have a normal load and spring mobility available to us. And when someone presents with an osteopathic or a type 2 inflare, then what you'll find is they have a little bit excessive movement anteriorly, but they lack medial spring mobility on the posterior ilium. And you'll find the opposite on the other side. So if someone has osteopathic inflare on the right, they'll have excessive spring anteriorly, but they will lack compression, medial spring on the posterior aspect. And when the client lays on their other side, you'll find that they lack medial spring on the anterior aspect, but they will have movement on the posterior aspect. And the way that I treat it is that I use a 2x4 by 8 inch piece of half moon foam, and I place it under the posterior aspect of the hemipelvis and have the client lay on that for 5 minutes. And then I have them lay on the other side, and I place it under the anterior ilium. And noteworthy is that it feels like they're teeter-tottering on this foam when they have the foam under the anterior ilium, but when it's under the posterior ilium, it fits rather nicely based on the curve of the anatomy there. And it's a very simple pattern to resolve, to restore normal movement in. And I can't say that I've had anyone have a dramatic response to the treatment of motion dysfunction called type 2 inflare or osteopathic inflare on the right, and type 2 osteopathic outflare on the left. And I have another video where I can contrast that with what I call type 1 inflare outflare that has more of an anterior posterior component. It's not subtle, whereas palpating landmarks such as the PSISs for the osteopathic type 2 inflare, there's a very, very subtle difference, if any, noticed. It is the spring tests that inform us about it. And I'm posting several videos discussing inflare, and I'll also discuss bilateral inflare and bilateral outflare. And thank you very much. Hope this is informative.